Back, everyone, and I hope you've had a really good morning. There's been a lot of interesting conversations around the things that Safaplace is really interested in. I'm Richard Allen. I'm part of Safaplace, have been a local parent at local schools, local governor, and I'm part of our campaigning operation. And the thing that we're actually campaigning around at the moment and want to extend our campaign and look forward to seeing many of you joining us in it or talking to us about it is the whole business of transition. Our campaign is called Lost in Transition. And ever since we've formed and beforehand, with all the backgrounds that we come from, we've been desperately concerned about the poor experience of transition experienced by young people going from CAM services to adult services. And we know that being 18 is quite a challenging time of life anyway, with all sorts of other transitions going on. But having to face the prospect of dropping what could have been very strong, important, life-saving support for young people at the time that they move to adult services without being unsure of what will replace that and what it will feel like, what it will look like. At the same time, you're dealing with perhaps leaving home, going to further education, higher education, sorting out relationships. It's all very difficult. And it's a serious business because it is a challenging time. 75% of lifetime mental illnesses start before the age of 25, and early intervention is really effective in reducing this. So there will be, as we've discussed already this morning, continuing emerging mental health difficulties for people 17 onwards. So even as they're just getting into grips with those, they may be having to change their service. So all the research shows that many young people are very bewildered by the transitioning processes. Families can find it difficult. And the concern is that despite their best efforts, adult services can be experienced as far less responsive to their needs. And this can all make life very difficult and risky. So I'm here with Dr. Rhiannon in England, who is part of the City and Hackney Clinical Commissioning Group and is the mental health clinical lead for that. And we're just going to have a bit of a chat through some of these issues and talk in a bit more detail about how transition is working. But if you've got any questions or anything you'd like to tell us, and we hope you have, then we'll be looking at chat and bringing that into the conversation as we're having it. So Rhiannon, if we could start by just, if you could tell us a little bit about your role and where CAMS and transitioning fit into it. Thank you.
Thanks. Yeah. So I'm a GP by background, and I've been the clinical lead at City and Hackney Clinical Commissioning Groups for a good few years now. And so my remit covers mental health services, and that goes through from CAMS into adults. So I'm responsible for the clinical input into those services, looking at how we can improve them, looking at how the services work or don't work. And because I've got the whole age spectrum to look at, obviously transition comes up an awful lot as a problem area for us sort of buying services for people in City and Hackney.
Sorry.
Yeah, go on.
No, I was just going to throw in the first question there. So what do you see as the key challenges faced by young people in transitioning to adult mental health services?
I think that CAMS services, young people find hopefully supportive, families feel supported, and it's a more services based on the need of the individual rather than perhaps diagnosis. Mm-hmm. I think in adult services, the sort of medical model kicks in. So what is your diagnosis? What is your treatment? Okay, here's your diagnosis, here's your treatment, cheerio. So it's quite focused. For CAM services, it's about how are you feeling at the moment? What's your need? What kind of therapy might be helpful? So I think there are big philosophical differences in how things are approached. I think with adult services, sometimes by necessity, it's about we assess, we diagnose, we treat, and you're out the other end, hopefully a bit better.
Yeah.
But ongoing support is a real issue.
Yeah, it's certainly true, because my own experience of the family using CAM services in Hackney, which was excellent, by the way, was that a very sort of holistic approach is taken. You're aware of how your whole life fits into what CAMS is providing you with, where it works well. Whereas I guess, as you're saying, from an adult mental health perspective, it's much more sort of interventionist, I guess more directly focused, rather than thinking what is going on for a whole person. So how do you think services can respond to these challenges? How can we make it work better?
I mean, I think getting adult services to slightly have less of a medical model fixation on diagnosis, that's a difficult challenge, because that's how mental health services are set up in this country. But I think, again, a sort of basic assessment of the needs of the individual holistically, and an attempt to have a whole package. So somebody might need education support, somebody might need training support, or employment support, or housing support. And rather than sort of signpost all over the shop to different services, try to provide a sort of one-stop shop model would be fantastic. I think, as I said, the issue of ongoing support is a problem, because whose job is that to provide? Is that a mental health services job to provide that? Is it social care? Is it the local authority? Is it the voluntary sector? And then you get into problems of who does what, and as always, sadly, who pays for what. So there are lots of sort of clunky bits that get in the way of having a good, more all-encompassing service.
Yeah, at the CAMS workshop earlier on today, I think we heard, obviously there's the role of WAMs in working schools, getting a whole school approach in place. And there was certainly a description of a sit-down meeting between adult services, CAMS, the young person and their family at the point of transition. But have we got further examples of effective practice in Hackney or nearby that you think we can learn from to help?
Yeah, I think a lot of the individual bits of services are starting to have transition appointments, as they call them. So, for example, eating disorder service, it's now quite standard. It didn't used to be that if you are a 17-and-a-half-year-old young person and you are not completely better, so that you need to be transitioned into an adult service, then you have a transition appointment into your adult service. You meet the adult service. So that's an example of good practice, and where it works, it's brilliant. I think other bits of the services really have not really done a lot of work together, and we are trying to bring the CAMS clinicians and the adult clinicians together in a room. I mean, it is remarkable sometimes they've not met before, especially if they're in one organisation. But I think that's how we've been structured. So yes, there are certainly good examples of that. Same for learning disability and other services. And it would be great to spread it to all bits of the mental health services in Hackney. Yes.
So what sort of recognition do you think there is of the problem among adult services and the services that they work with? Is it something that there's a sort of will to work with, but not quite sure what the solution is, or do they see it another way?
No, I think that adult services are very aware of it. I think they perhaps feel remarkably pressurized to manage in the way they've managed, and change is quite a difficult thing to achieve, but small inroads are very helpful. So for example, in our talking therapy service for mild to moderate depression and anxiety, which is called Talk Changes in Hackney, they now have workers who specialize in seeing 18 to 25-year-olds. So that's great, because it doesn't mean all 18 to 25-year-olds would need that, but it does start influencing the whole culture of the service, and it is great for those young people that need that service. We have a transition service from Off Centre, which is hugely popular and very oversubscribed, and we have big waits, but it shows the popularity for young people themselves of having a specifically tailored service. So I think there's a place for both, a specific service and to get existing services to provide a sort of service within a service, if you like.
So I suppose it's about how the services can become more like one another. It's not just about the point of transition, but to avoid transition being such a jarring experience that the adult services begins to feel a bit like what the younger person had already experienced through CAM services, that kind of thing. So on that, what type of changes do you think we should be looking for in campaigning around transition?
Well, I think smooth pathways. So I think it would be really great. I mean, what I would love is that every young person leaving a CAM service has a pathway of support into, and it might not need to be into an adult mental health service, but that they don't just leave the service into nothing. So I would like a sort of network of support that's quite prescribed. So, for example, a review appointment at your GP surgery, a review appointment with a voluntary sector group like Well Family, who work in every surgery in Hackney, perhaps into Young Hackney or some other voluntary group. It doesn't have to be a sort of medical provision, but I think that should be on offer for every young person so that they know where they will get support. And of course, those young people that might need transitioning formally into mental health services, obviously that would happen as well. But it sounds pretty obvious, but it doesn't exist yet in a quite formalized way. So in other services, for example, if you go and see the cardiologist because you've had a heart problem in hospital, you then have quite a formalized review process with your GP. You don't just get discharged into nothing. And you might have a rehab service, and you might have a social prescribing service appointment. So why don't we do that for mental health, I suppose, is my question.
Yeah, it's a good question. So one of the things we're particularly interested in is actually making the change of transition more flexible so that it would be somewhere between the point of 18 and 25 rather than bang on 18. What would that be possible? Is that something you could see working in any kind of way, and how would one make that happen?
I think there's a lot of push to work across ages. I think probably the biggest handicap is the way training has been organised in this country. So you're a child practitioner or an adult practitioner. So I think chipping away at the edges is good, and trying to get people to think about 0 to 25 services. But it is difficult with the different training. Child psychiatry is a different training now from adults. There's not many people who feel comfortable seeing young people as well as adults. So that is a real difficulty.
Okay, well, we've got a few more questions from people in the conference. Firstly, from Therese, where does one get help if at a Hackney school but live and have a GP in another borough? Is it via school or via the GP?
That's a difficult one. For the in-school services, you can use the in-school services. So if your school has a counsellor or WAMS or the mental health in schools teams, you can use those. But if you are going to be referred to more formal CAMS services, that has to be through your GP. And so it will be where your GP is based. That's just a craziness of how things are set up really at the moment.
Yeah, and another question here about in working with this and the importance of peer support. Where can the peer supporters get their support?
Well, very good question. It is a very good question. I think that we have some sort of setups. I mean, perhaps that was talked about earlier. Things like the Cool Down Cafe at the Peabody, which is started before lockdown, but now sadly is all online, where peer mentors are being trained, and therefore they get mentored. So if you're a peer supporter, a peer mentor, you have your own mentor. And I suppose it's building in that sort of structure. I mean, there's informal mentoring that all of us do for all of it, a chat with our friend, yes. But if you're doing more than that, then you need somewhere to be able to go. So we need to set that up so that, you know, everyone that's doing peer support is getting their own support, definitely.
Yeah, and then you could see that peer support obviously wouldn't be affected by the barrier of 18. It could just continue and grow,
Yes.
and enabling people to become peer supporters is certainly something that's come up in the conversation earlier on, and a really important part of spotting what is or isn't going on for somebody. Okay, so a question from Sarah here. Have you surveyed young people about their transition experiences in Hackney?
Good question, and I suppose I'd say no. That there have been surveys, CAM surveys, definitely done. Specifically about transition, no. I'd have to go and find out when the last one was. But yeah, it's definitely an area of concern.
Yeah, it's a good question, and clearly it's something that we would be very interested in and could maybe participate or help initiate in some kind of way, because it's, you know, it's the first way of getting to grips with the problem. Rose has suggested looking at Kooth.com as an excellent website for young people, and
yes.
Yeah, and that Kathy's made the point very clearly that young people need real people, not just virtual ones, and that's a continuing challenge for us at the moment of how to turn what's virtual into the real.
It's a huge problem, and I think that comes up a lot in that there might be an assumption by older adults that what young people want is online, and what we do know is what young people say, which is they want both. So face-to-face is desperately needed, and is a real challenge in COVID. But I would wholeheartedly support looking at Kooth, and we're going to promote Kooth more, because I think it's a fantastic online resource.
Yeah, and Sophie's just made the point here that I was thinking of, which is that it can be the case that for some people working online works really well, that it, you know, they feel more able to be open and talk, and they're not forced to turn up at a particular place at a particular time, and that can suit people very well, and it's important not to lose sight of that, I think, as we go forward.
I think, yes, I mean, we have to think about digital poverty. It's not for everybody, but certainly the big pluses are not traveling, doing it in the comfort of your own home, having a bit of a counselling session or whatever. There's huge pluses, as well as some things we have to be concerned about.
Yeah, and Lucy here has made the point about social prescribing, which one could certainly think of as something you'd incorporate. I mean, for those who aren't familiar with the idea, it involves looking at somebody's whole life and what other things they can be helped with to enable them to deal with the condition that they're facing. So whether that's art therapy or social life or whatever it happens to be. Okay, we're going to have to draw it to a close there. Just to say, and thank you very much, Rhiannon, that was really good. Just to say that we are going to be continuing to campaign on this, and we'll be putting it on the website, blogging about it, and looking forward to getting everybody involved. And the particular point is, does it really have to be 18, or is there a way that we can make it much more flexible? So thank you very much, everyone, and we will soon be taken back to the main stage for the final talk. So thank you very much.
Thank you.